Hi.
Hi.
My name is Elena Lisser. I will be your nurse practitioner today. How are you?
Yeah.
Are you here for, what are you here for?
Checkup.
Just a physical. Okay. Oh, I will clean my hands and we'll go ahead and start. So initially, just looking at you, sir, I see a Caucasian male in your 40s, athletic build. I am going to go ahead and start from your scalp, if that's okay. I'm going to look for your hair distribution. I'm going to palpate your scalp. I'm going to make sure it's not tender. There's no lesions. There's no any dandruff, alopecia. There's no rashes. It all looks intact. And your hair pattern is great. Your skin looks appropriate for your genetic background. It feels cool, warm. It's pretty warm. It's dry and it's smooth. I don't see any pigmentations, any rashes. I'm also going to look at your nails. They look smooth, non-tender, and your cap refill is less than 2 seconds. I'm also going to do a little turgor right here, less than 3 seconds, and a turgor here, less than 3 seconds. Okay, wonderful. We're gonna move on to your face now. I'm inspecting your face. It looks symmetrical. Your eyes, your ears, everything. There's no drooping. There's no twitching that I can see. I am gonna test a cranial nerve number 5, the trigeminal cranial nerve. If you could just clench your teeth really tight, and I'm feeling your muscle right here. Also, I'm gonna test this. Keep your eyes closed for me, please. Tell me where you feel this soft cotton ball.
Left.
Tell me where you feel it.
Right.
Okay, that's trigeminal nerve number 5, and I will go ahead and check your facial cranial nerve as well. If you can raise your eyebrows and smile, and then go ahead and puff out your cheeks. Okay, beautiful. And that's facial nerve number 7, cranial nerve number 7, facial. I'm also going to check for your TMJ, your temporal mandibular joint. If you want to go ahead and open it, okay, and close, and I don't feel any clicking or grating when you do that. Also, I'm going to check for your temporal arteries. I'm going to palpate them first, and then I'm going to auscultate them also. Okay. And I'm just making sure I don't hear any bruise. I'm also going to look at your neck, sir, if you don't mind turning to your right. And I'm looking for a jugular vein distension, which is not here. I'm going to listen to your carotid pulse. And then I'm going to look on the other side, no jugular vein distension here. And I'm going to feel for your carotid pulse here. Okay, beautiful. And if you don't mind, I'm going to look at your neck and make sure visually it's symmetrical. There's no enlargement and no asymmetry, no nodules that I see. Go ahead and swallow for me one time. Okay, and I can see that your thyroid and your thyroid tissue and your corticoid tissue all rise up symmetrically. I am just going to make sure that your accessory cranial nerve is intact. And go ahead and bring your shoulders up. Okay, beautiful. That's the accessory nerve. Now I'm going to assess all your lymph nodes. I'm just going to do a circular motion bilaterally. The first one will be the periauricular in front of your ears, and then the parotid a tiny bit lower, and then postauricular behind your ears, occipital behind at the base of your skull, and the submental underneath your chin, submental, submandibular, and then the superficial cervical, and then the posterior cervical, and then the subclavicular lymph nodes. And all these look non-tender, nothing hurt, and they're not enlarged. So that is wonderful. Let's go ahead and move on to your eyes. You can open your eyes, and I would like to check your visual acuity, and that is cranial nerve number 2. If you can just close one eye and go ahead and read those letters that are 20 feet away.
CD, FJH.
Okay, switch eyes.
CD, FJH.
And then both eyes.
CD, FJH.
Beautiful. Go ahead and sit down. Your vision is 20 out of 20. We'll do a few more things for your eyes, okay? first we'll do the corneal light. Actually, we'll do the confrontation test. Go ahead and close one eye, and I'm going to show you. Tell me how many fingers do you see in each area?
2, 2, 3, 2.
Okay, and switch eyes.
2, 1, 1, 2.
Okay, beautiful. And when you do that, and go ahead and cover one eye one more time and just, okay, and then switch eyes. Okay, and I don't see any lid lag or any strabismus. Okay, and then we're gonna do the corneal light reflex. I'm gonna be fairly far. You go ahead and look behind me. I'm just gonna shine this into your eyes and make sure there's a corneal reflex to this light. Okay, they both react. Also, we are gonna do the 6 fields of vision test. Go ahead and keep your head steady and just follow this with your eyes. Okay, beautiful. I don't see lid lag, and your eyes move symmetrically and in sync. I am now going to check your pupil size. Just look behind me. And they seem to be about 4 millimeters. And now I'll just check your eyes for and their reaction to light. I'll check their direct reaction to light and consensual. Just go ahead and look behind me. Okay. And they both seem to react to direct light and consensual. One more test is the accommodation test. Go ahead and follow my pen. Okay, and Perla pupils are equal and reactive to light and accommodation, and consensual. The last one we'll do on your eyes is to look at your optic disc. We'll just turn off the light for this, and I'm going to use my right hand to check your right optic disc, and I'm going to make sure that it's reacting, and I see the red light reflex, and it looks yellow and smooth. And I'm going to do my left hand for your left eye, and I see the red reflex in your optic disc, and it looks yellow, creamy yellow, smooth margins, and there's no clubbing that I see. And we'll turn on the light. Okay, so optic nerve intact, oculomotor nerve intact, number 3. The 4th, the cranial nerve trochlear, and the 6th, cranial nerve abducens are all intact. After all these tests, we are going to move on to your nose, sir, if that's okay. I'm inspecting it to be symmetrical. I'm going to palpate the ridge of your nose. It's non-tender. I don't see any drainage. I don't see any lesions. I'm going to look inside your nose for your membranes, if that's okay. And it looks moist and pink and no obstruction. I don't see any lesions. Okay, that looks wonderful. I'm going to move on to your ears now, if that's okay. Again, inspection first. I'm going to make sure that they're intact. I'm going to make sure they're symmetrical. They're non-tender, there's no drainage, there's no lacerations. I'm going to look on the external canal and make sure it's nice and smooth and pink. And I'm going to look inside your ear canal, if that's okay. And I'm going to see your tympanic membrane, that's pearly gray. Okay, and no foreign bodies, no lesions. I'm going to do the same on this ear. I'm going to look on the external side first, and then I'm going to look inside. Again, it looks pearly gray, no lesions, no redness, no foreign bodies. And we're going to do a few tests for your ears. First, we're going to do the, to make sure your acoustic cranial nerve 8 is intact. I'm just going to do the whisper test. Tell me what you hear.
25.
Okay, and we'll do this ear.
62. 32.
Okay. That's intact, so your cranial nerve 8 is intact. This is a tool we're going to use for another 2 acoustic hearing tests. And I'm just going to put it on top of your head. Are you ready?
Mm-hmm.
Okay. This is the Weber test. Tell me if you hear it equally on both ears.
Yeah.
Okay, and I'm going to do it now one ear at a time. It's a different test. It's called Eent test. Ready?
Yeah.
And then do you hear it here?
Mm-hmm.
Okay, and the last one on the other side. On your mastoid process. And then do you hear it in front?
Yeah.
Okay, beautiful. So Weber and Eent tests are good. Okay, sir, the last thing, I apologize. I forgot to palpate your sinuses. So I will just palpate your maxillary sinuses. Are those tender?
Mm-hmm.
I'm also going to palpate your frontal sinuses. Are those tender?
Mm-hmm.
Okay, and just for your orbit, I'm going to palpate around your eyes, your eyebrows, and make sure there's no tenderness here. I'm also going to, if you open your eyes, I'm going to palpate and make sure your conjunctiva is nice and pink. And it is, and your sclera is clear, and there's no drainage, and they look symmetrically and normal. The last one we're going to do is your mouth, and I could tell that your lips are pink color. They're symmetrical. I'm going to look inside your mouth if that's okay. I'm going to look for your teeth, and they're intact. I'm going to look for your gums, and they're pink and moist. I'm looking at your hard palate and soft palate, and there's no lesions, no rash. If you could just stick your tongue out for me and protrude it and turn it side to side. I'm going to make sure there's no white patches, there's no rashes on your tongue. Beautiful, thank you. And I could also see there's no tonsils. Did you have a tonsillectomy when you were a kid? Okay, so I don't see tonsils, but I do see your uvula. And I'm gonna have you stick out your tongue, please, with my tongue depressor, and just say ah. 1 second. Okay, go ahead and say ah. Okay, and I see the uvula rising properly, and this is hypoglossal cranial nerve that's intact, also glossopharyngeal nerve that was intact, and the vagus nerve in the vagus cranial nerve was also intact. Any problems with your taste?
No.
Okay. I think this is it for today. Do you have any questions that I can answer?
No.
Okay, wonderful. Thank you.